Hello, everyone. It's a pleasure to meet you online. My name is Natalia Kovalkina. I'm a dermatologist and the Director of Medical Relations at Vichy Laboratoire. And today we are going to discuss with you the consensus to clinics, applying international anti-aging guidelines into your practice. And as an honored guest, we have Dr. Zoe Draelos, who is joining us today. She's the expert of cosmeceuticals in the US, and she's also the practicing dermatologist, clinical dermatologist. So welcome, Zoe. Thank you so much for joining. I leave you the floor, the screen, to take over to explain, first of all, the methodology, how these guidelines was achieved, and then we're going to deep dive into the patient cases together.
Wonderful. Thank you so very much. Well, many years ago, I was trying to figure out exactly how to organize all the myriad of skincare products and cosmeceuticals into an organized framework that the dermatologist could use in making patient recommendations. Going back to the ancient pyramids, it seemed like the idea of using a skin health and beauty pyramid might be worthwhile, starting at the bottom with the most basic of skincare items and all the way up to the top, looking at many forward-thinking, more advanced cosmeceuticals. Basically, the way I conceived of the pyramid was the very bottom of the pyramid. The structure was for protection and repair. This would include, of course, wearing sunscreens with an adequate SPF and using antioxidants. Once you have the foundation, basically, for protection and repair, then you want to address issues of moisturization, including exfoliation and cell turnover. Retinoids and alpha hydroxy acids are the mainstay of the ingredients in these products in the middle of the pyramid. At the top of the pyramid, we have stimulation. That includes peptides and growth factors. This concept was originally published in the Journal of Drugs and Dermatology in 2014. The very basic pyramid structure was conceived of. It was then updated in 2021 to include some newer, more advanced cosmeceutical concepts and new ingredients that had entered the marketplace between 2014 and 2021. So basically, at the bottom, we have our daily skincare protection. Then we have our upgraded skincare and our advanced skincare. And if you use this pyramid to assign treatment recommendations for your patients, it's my hope that this will simplify it not only for the recommending dermatologist, but also for the patient who has to undertake and use this skincare regimen every day. So let's move forward here then and take a look at our next slide. So the goal of the publication of treatment recommendations from the International Panel in 2024 was several-fold. The publication objective was to expand the pyramid concept to provide a scientifically validated tool for recommendations on the best topical anti-aging care for diverse and inclusive populations. The original publication didn't take into account the myriad different needs of various different Fitzpatrick skin types. The idea is to adapt the pyramid concept to cover different genders, ages, phenotypes, pigmentation, lifestyle habits, and skin issues to include sensitivity, acne, melasma, and other skin diseases. Using this tool, it was hoped that the dermatologist could start by recommending basic essential products for protection and repair, and then work up to the top of the pyramid to more advanced products that may be appropriate for specific concerns. So here we're taking the original pyramid, putting it into practice, showing how it actually works, and this led to the first anti-aging guidelines on patient cases, including multiple phenotypes and different lifestyles, that was published in January of 2024 in the Journal of Drugs and Dermatology, the third update to the skin pyramid concept. The methodology was to develop a panel of 7 international dermatology experts. 8 hypothetical cases were developed that were representative of the skincare needs of diverse populations. A questionnaire on various cosmeceuticals was then developed. This questionnaire did not include procedures, medications, or oral treatments. This was strictly for topical application to encompass the pyramidal approach to cosmeceutical and cosmetic and skincare recommendations. It was based on 8 scenarios scenarios. These 8 scenarios were then sent to the 7 international experts for evaluation and comment. The methodology was this, and this is how the expert consensus was conducted, and this is how the expert consensus was defined. We used the RAND-UCLA appropriateness method. The concept of appropriateness refers to the relative weight of the benefits and harms of a medical or surgical care. We then have the appropriateness procedure, which is the expected health benefits must exceed the expected negative consequences by a sufficiently wide margin such that the procedure is worth doing exclusive of cost. It was done on a scale of 1 to 9, and in order for appropriateness to be established, the individuals on the expert panel had to rate a 7 to 8, which means usually appropriate, the first-line treatment usually used, or a 9, totally appropriate, a choice treatment. If a 7, 8, or 9 was not rated by the expert panel, it was not felt that this recommendation should move forward. Here's a nice flow chart that basically shows the methodology for the agreement and appropriate indicators which are required from the RAND-UCLA methodology. The first assessment is for agreement, and you see that at the top of the slide there. Disagreement would mean greater than 3 panelists were rating in the region of 1 to 3. Agreement meant that greater than or equal to 2 panelists were outside the 3-point region containing the median. For appropriateness, it was rated from inappropriate to uncertain to appropriate, and in order for it to be judged appropriate, the expert panel median had to be in the 7, 8, or 9 range without disagreement. Thus, methodologies were only moved forward once agreement and appropriateness was established. Once agreement and appropriate was established for each of the scenarios, that methodology was then moved forward, and that formed the basis for the recommendations that were put forward in the Journal of Drugs and Dermatology article.
Zoe, I was wondering, the exosomes were not part of the ingredients listed in this publication and not considered for these guidelines. Is there a reason for that? Because it's the buzzing ingredient, everyone is talking about it, and every aesthetic congress and dermatological congress, there are always some polemics about exosomes. So what's your take on that? Why they were not included into these considerations, into these guidelines?
Well, exosomes are new, and they're so new that it's really not been well established as to if they go in the bottle, does the exosome come out of the bottle, are they stable? Platelet-rich plasma probably functions because of exosomes, but it's your own blood that's drawn, it's your own exosomes. They're basically taken from the blood and either injected into your face, into your scalp for anti-aging or hair growth purposes. But exosomes that are in a bottle, those could be a biologic substance. So there has been some concern about the safety, and there also has been some concern about the stability. So exosomes are a little bit too new at this point to figure out where they go in the pyramid and what their value might be to consumers.
Right, thank you. And I also believe it's a little bit of a question of the safety as well, because the long-term effect is not yet studied properly. So I agree that we need to wait a little bit before plugging it into our guideline, into our considerations. And maybe we're going to have a new update version in a few years where we're going to include the exosomes into our pyramid and see where it would feed into.
True. I mean, the pyramid needs to grow as technology grows, and our offerings to improve facial appearance grows as well. And that's exciting. That's the exciting part of it, to see things getting more sophisticated and more efficacious.
To our dear audience, if you have any questions, please don't hesitate to put them in the chat. We're going to be happy to take your questions. And as Zoe mentioned, we also developed 8 different hypothetic scenarios of the patient cases that includes different ages, men and women, different phototypes as well. So today, unfortunately, we don't have time to go through all 8 cases. So I propose just to zoom in into one scenario, just for you to see the flow, how to apply this methodology and these recommendations into action. So I propose for you to zoom into the scenario number 5, where a 40-year-old female with Fitzpatrick skin type 1 has initiated botulinum toxin treatment for her lamellar lines and had hyaluronic acid injected into her nasolabial folds. She wants dermocosmetic solutions to complement the anti-aging procedures and optimize her skin texture. She always uses sunscreen, but lives and works in an area exposed to urban air pollution. Quite a typical scenario that probably fits most of us connected online, no matter where we are at this time. So to approach to this scenario and to this methodology, as Zoe mentioned, we look through different ingredients available in the cosmeceutical world at this moment. That includes hyaluronic acid, vitamin C, vitamin E, peptides, everything. So all of that was analyzed by the panel of our advisory board, and we came up with fitting them into the pyramid that Zoe explained. So we start with the protect and repair, the base of the pyramid. So this is the must-have, the basic treatment that the patient must have in this case. The recommendation of the board was to focus on niacinamides, which is the form of vitamin B3 that provides the skin barrier support, boosts the collagen production, evening the skin tone, and also has the antioxidant effect. And also to include vitamin C and vitamin E that have even more powerful antioxidant effect, which is highly recommended together with a good cleanser after being exposed to urban pollution, which is the case of the patient in this case. And on top of that, of course, we need to think about photoprotection. Tinted photoprotection would be recommended in this case, together with physical filters, in order to provide UVA, UVB, and also the protection from the visible light. Note that tinted tone and texture needs to be adapted to Fitzpatrick's skin type, and in this case it's phototype 1, so we need to make sure that it's comfortable for our patients to wear this photoprotection that we recommend. Then we can move to upgrade the skincare, this middle part of the pyramid. So what else could we advise for this kind of patient? So first of all, alpha hydroxy acids. In this case, be careful with the high concentrations and low pH, especially in darker phototypes, and also not to launch any sensitivity or irritation of the skin. Then C psilocybin that enhances glycosaminoglycan synthesis, which brings firmness and elasticity to the skin. Hyaluronic acid would be also in the middle of the pyramid in this case, and retinol. Retinol accelerates the cellular turnover, improves the skin texture, evens skin complexion, promotes the collagen production. So that fits very well into the requirements that we had in the patient to work on the texture of her skin. And now let's move on to advanced skincare, which is the top of the pyramid, where in this case we would recommend the peptides. Peptides are the short chain of amino acids and play a crucial role for skin age management process. So they stimulate collagen and elastin production. They provide the skin barrier function as well, and have the anti-inflammatory properties. Zoe, do you use peptides in your practice, and why have you and the panel chosen to put peptides at the top of the pyramid? What is so special about them?
Well, peptides are new and unique. They basically are designed to redirect the skin by providing in cellular messengers. So whereas niacinamide, alpha hydroxy acids, retinol are used in very high concentration of formulations, peptides, because they're cellular messengers, are used in very low concentration. They have a totally different mechanism of action. They don't exfoliate the skin. They don't activate the retinoid receptor, but they add a third unique method of reprogramming the skin. So for example, one of the most popular peptides basically is a fragment of collagen 4. So you expose the skin to that cellular messenger results in the formation of new collagen. So it's another very unique way way of reversing the signs of aging in the skin.
Great. Thank you. So we went through the ingredients now, and of course, I'm representing Vichy. I would like to let you know that we have the solutions for all the ingredients that we mentioned, most of them. And we can try to fit them into this pyramid and to see what it would give us in terms of the selection of the products. So you see here the two main lines, which is the must-have of the products of the pyramid, and we're going to go through them very quickly, and also nice-to-have. So these are the additional products that we can concerning our problematic in this case. So about the must-have, we of course go for the photo protection. We have the photo protection Capital Soleil UVH, also the tinted version that would fit all skin types and skin tones. We would also recommend to use Lift Active Collagen Specialist Cream. That would be the part, it can be used on the bottom of the pyramid because it contains niacinamides, which is the base of our pyramids, as well as the top of the pyramids because it also has the rice peptides and vitamin C. So this product would be the essential in this case to fit at the bottom and the top of the pyramid. And also Lift Active Vitamin C Serum. We say that we'd like to boost the anti-pollution effect, antioxidant effect, so that's going to be a good solution for that. And Lift Active Retinol Serum as well for the middle part of the pyramid to stimulate the collagen and elastin production and also even the skin tone complexion. Zoe, do you have any comments about this prescription?
And I think that's a very all-encompassing program. And I think what we might want to talk a little bit is about age. So, younger individuals might focus on the bottom of the pyramid. But as aging needs become more present and more concerning, individuals can then work their way up the pyramid by adding sequential products to achieve different effects. So one nice thing about this pyramid is it works for all ages, all different age, all different stages of life, and also for both men and women.
Absolutely. And also different skin tones. As you can see, the Fitzpatrick skin tones were also considered into this panel as well for the inclusivity reason. Okay, great. I think we covered all the topics, all the ingredients. I invite the audience to write your questions in the chat, and we are here to answer them to make sure that everything is clear and you can apply this methodology with this concept into your practice.
Well, thank you so much for listening to this concept. The aging pyramid and the skincare pyramid is something that's near and dear to my heart, and this pyramid has withstood the test of time because it's gone through several different revisions as new and more exciting cosmeceutical products and ingredients have entered the marketplace. And I hope you find this pyramid concept very useful as you move forward in making skincare recommendations to your patients.
Thank you, Zoe. We're waiting for your questions. Thank you very much for your attention. Hello, everyone. Professor Zoe Draelos and Natalia Kubelkina here to answer your questions. Thank you so much for your activity and for taking time to watch our webinar. There were some questions in the chat today, and we're going to address some of them. Some were writing back to you on the chat, and some questions we're going to bring here to the open discussion together with Zoe. First of all, please make sure that you get the link of the publication of anti-aging guidelines, which is the first message in the chat. This way you can have a full access to the entire publication and to see all patient cases, all 8 of them, because today we only zoomed into one of them. But if you open the link, you will be able to see that, to get access to all the information. And now let's get to the questions. There was a few questions in the chat about the peptides and the way of action of the peptides on the skin. Zoe, would you like to take this one?
Sure. Well, peptides are usually collagen fragments. At least the signal peptides are. And the signal peptides are so named because they signal some unique physiologic event. And so, for example, a very commonly used peptide might be a fragment of collagen. And the idea is that you flood the skin with these collagen fragments that downregulates collagenase, and then that prevents collagen destruction, which is found in mature individuals. The other thing is that peptides can also interrupt the neuromuscular junction, for example. And those are neurotransmitter peptides. And then there are also carrier peptides, and those peptides are designed to carry active agents into the skin. But the ones that actually reprogram older cells to behave like younger cells, if you will, those are your signal peptides, and they provide a signal. They're used in very low concentration, but the intent is to tell the skin to behave in a certain fashion that's more beneficial for the appearance of the skin.
Great, thank you, Zoe. There was another question about NAD and NAD+, which is also used as an anti-aging ingredient. My concern with NAD topicals is the stabilization, because I know that it's a very fragile molecules, so to make sure that they deliver the energy to the cells, to improve the cells turnover and the stimulation of collagen and elastin, they need to be very well formulated. The product needs to be very well stabilized to make sure that action is delivered. So would you, for example, prefer to use topicals or injectable NADs? And do you use them in your practice?
Well, I think you have to ask yourself about topical NAD, because that is an intracellular substance, not an extracellular substance. So in order for it to be functional, it basically has to get intracellular. If you put it on the skin and it stays on the stratum corneum, you're not in the right biological location for NAD to have any function. So the topical application of NAD can be a little bit problematic, because it's hard for me to work out physiologically how stratum corneum applied NAD actually functions to increase cellular metabolism.
Agree, yes. Thank you, Zoe, for your opinion. There was another question about skin cycling and how it can be introduced into the pyramid. So for those of the participants who don't know, the skin cycling is the methodology which is advised by one of the dermatologists, which is based on turning the products every night, meaning that every one night you apply exfoliator, the second night you apply retinol, and the next 2 nights you just use the hydration and reparation of the skin. So this is a very nice approach in order to decrease the skin sensitivity and increase the tolerance to retinol. So it perfectly fits the pyramid, because the ingredients in the pyramid and the approach to the skin problematic will remain the same. It's just the frequency of application which is different. So this way, if your skin can tolerate application of retinol every night or every 2 nights, why not to go for that, to have a maximized effect in a shorter period of time. If you're experiencing skin sensitivity or intolerance and you prefer to space out application of retinol, then this skin cycling approach could be the solution as well. Okay, do we have any more questions? Yes, there is a question about what is the main reason for the skin aging. Well, I think here with Zoe we will probably agree that UV radiation is the main cause of the skin aging and the skin damage, and this is also the reason why sun protection is the base of the pyramid. That's a must-have. You can throw away everything else, but you absolutely must keep sun protection, and to make sure you do apply it daily, no matter what is the season, no matter how much time you spend outside, because visible light is also affecting our skin. So I would say the sun protection is the key. Zoe, do you have something to add to that?
Yeah, sun protection is key. Basically anything that prevents the skin from having reactive oxygen species penetrate, because UV radiation strikes oxygen within the skin, creates reactive oxygen species that basically damage collagen. So pollution also creates reactive oxygen species. So does combustion byproducts like smoking. Visible light certainly can also have an effect, as well as infrared. And then poor sleep, poor diet. All of those things that create reactive oxygen species cause damage, and all of those have been renamed the exposome. So basically, protecting yourself from the and exosomal damage, right, is the best way to have great looking skin.
Definitely. Great. Well, I think we tackled all the questions for now. So thank you very much all for participating and staying with us today. It was a pleasure, and thank you for your activity. And we're going to prepare new webinars for you soon. So stay tuned and have a nice afternoon. Thank you very much.